All right, so just to let everybody know, this Zoom discussion will be recorded so that we can post it on our N4C website for later viewing for those of us or those that couldn't join this afternoon. So just so you're aware, you will be recorded, and we are going to record all of the chat comments as well and post those in case people post any ideas or websites, resources, and that sort of thing. So just to introduce myself, my name is Kelly Jamison. I am on the N4C Board of Directors. I'm the secretary of our board, and I also help out with our communication and outreach committee. And everybody should have the ability to unmute themselves. If you don't, just let me know. I'm going to keep checking over on the side to see if others are waiting to join. But we are here this afternoon to talk about reopening and the staffing and enrollment side of that. So for those of you that are just getting started with your reopening plans and are here to learn or ask questions, please do. And for those of you that have reopened and have gone through this already, please share and enlighten all of us with your experiences. So I'm just gonna open it up to everybody and let you guys guide the conversation. Does anybody have a question they'd like to ask?
So, hi, I'm Jane from Georgetown in DC. We are looking at the guidance going forward for stages of phase 2 and 3, as we're in phase 1 right now. And the group size limits remain, at least in the recommendations to the mayor, they remain at 10 group size limit, including staff. Is anyone else seeing numbers going up in phases 2 or 3 before we get to the vaccine stage? Yes. To what?
In Indiana, the governor has declared childcare an essential service, and we are supposed to and are able to follow licensing regulations, which doesn't restrict group size.
Okay.
Regardless of this phase we're in.
Right. Because phase 2 for the general public goes up to 50, and in phase 3 it goes up to 250 for public gatherings. But so far, it's good to hear. So Indiana, any other states that are going up?
Hi, I'm in Nebraska. So we're at 15 right now. And we
phase
plan on
1.
opening, yep.
Okay.
So here in Florida, we kind of have the same recommendation that it's to your licensing standards, and licensing is very vague and says just, you know, what you can accommodate type of thing. So we've been following CDC recommendations and just keeping it to group sizes of 10, including staff. And we are about to go into phase 2 of our reopening plan, which is actually just adding more classrooms. We opened at 25% capacity and in 2 of our centers, and we have 3 here at the University of Florida. So yeah, we're just not feeling comfortable yet going with larger group sizes.
Yeah, we are on top of the the group sizes, what's troubling us the most is a lot of our spaces are open, and so they're considering any spaces that are divided by partial walls or gates to be space. And the partitions, I don't know if it's the case in your jurisdictions, but the partitions, 7-foot partitions can be used, but you have to have a clearance of 6 feet on either side, which takes away 12 linear feet, which kind of makes it useless to try and divide up our spaces, which what we were trying to do, what we would try to do otherwise to have more smaller groups. But at this point, we would only be able to accomplish, we'd be able to accommodate less of our current enrollment without finding other spaces on campus. So, I mean, our group sizes are not more than 12 anyway, but that doesn't include staff. Do you all see the CDC guidelines? Are they forecasting what the recommendations are going to be beyond phase 1?
I haven't seen it. I don't know if anybody else has.
No.
In Massachusetts, they keep saying everything's going to be data driven, not date driven. And that's the MO. And anybody else from Massachusetts who has not slept and has been crying since Monday when the non-contact, it's practically impossible fiscally, but it's almost impossible morally. If you care about children, to put them through what they're anticipating or what they're recommending. So we're fighting it. I heard the New Hampshire folks, anybody here in New Hampshire, bravo. I heard they sent the regulations back to the state and said, no, we're not doing this. They're wrong. I was like number 14,974 at 1:30 last night when I signed the petition in a cold rage of everything. It's pretty scary. But the one thing they've said in Massachusetts is they've given us 10 preschoolers with 2 teachers, which, sounds fine, except for most of us in campus childcare programs have much better ratios and have our teachers work a 6-hour day. And the one thing I'm wondering is if anybody's done anything flexible with schedules who's already open. Our teachers work 30 hours a week, but children have 5 hours of paid planning time. And wanted in the middle of a pandemic with all the other stresses and, potentially having to wear masks, which we're trying to dial back so that the family group doesn't have to wear, the little cohort doesn't have to wear masks. So just wondering if anyone's been creative with we're thinking Monday through Thursday, if it ends up being 2 teachers, that kind of stuff.
Yeah, so we're thinking about a part-time schedule as well as an option. Not sure what that would look like, whether it be partial, like a week on, week off, or a Monday, Wednesday, Friday, Tuesday, Thursday option. But the reason we wanted to try and numbers a little bit is because ideally, I think it's better health-wise to not do part-time, but to do full-time and keep everyone in their little cohorts. And if we could raise our numbers a little bit, we could do full-time and not have this back and forth, and you don't know where kids are going on their off days. And so that was kind of the impetus, not just financially, but just for the health reasons of being able to do full-time and keep our groups very stable.
I'm particularly curious. I live in Indiana, but working in Texas, I have very different approaches to this. And I'm wondering, with those larger groups of children, how are your parents responding to that? Are they comfortable bringing their children with larger groups?
Well, we haven't gotten to that point yet. We're not open. And so it wouldn't be any larger than they would pre-COVID. But the reason that we, I think they would be more off put by the part-time. than full-time, but larger numbers. And heard from one of the higher ranking officials in DC Department of Health is that the reasoning for the smaller numbers is for contact tracing. And if that's the reason, if that's the rationale, then I do believe that we can accomplish effective contact tracing by raising it just by 2 to 4 children per group.
Mhm.
If the rationale is that it's, you know, they're super spreaders or whatnot, I understand that, but that's not what the DC Department of Health has told us or for tracing,
Thank you.
which would be harder if you have a part-time schedule as well.
So I'm not sure about others' experiences, but when we opened for phase 1, we opened 2 of our 3 centers, and we had a hard time actually filling some of the spaces in certain age groups. We had, especially in the older age groups, the 3s and 4s, a couple of those classrooms actually didn't even reach the capacity we were trying to. Parents just weren't comfortable yet. So they were put on our waiting list for phase 2. But with our first phase of our 3rd center, which we are opening on June 15th, we took a different approach to it and kind of did a first come, first serve sign up if you were interested or needed care then, which was much better enrollment wise, because our enrollment coordinator in the first phase, it took her a whole week to reach out to families individually to see if they were interested in care. But this go around, it got filled up. She was able to make our rosters and we were able to staff accordingly. But I don't know if anybody else had that same sort of experience with really just not even being able to fill spaces.
We haven't started calling families, but I'm starting once June 1 hit. That was the end of school, the start of. So I went ahead and sent out an email just to touch bases, remind everyone, you know, if you are looking for re-enrollment, this is what that's going to look like. We still don't have a date. If you are planning to go somewhere else, please let us know. And immediately I got 4 emails for people who enrolled their children somewhere for the summer. And so I'm worried that when I start to call, people will have already made those decisions. We do have a wait list that families keep joining every day wanting care, but I don't think anybody wants summer care. And I saw that in the chat too. Everybody just wants to know, will you be open in the fall? Can you give me a fall day? So if we in the summer, I'm worried that we won't fill all those spaces.
We are trying, I mean, I don't know if it's even going to happen, but our hope or original intent was to try to do a transition work week, get the children to kind of visit one-on-one the week of the 22nd, and then try to reopen on the 29th. And that was before we got hit with what the regulations. And I did a survey, which you can see my little map here on SurveyMonkey. So we have 45 coming back who said they want to come back, and 15 who are not for the summer, and I still have to hear from 20. So, and that's a lot for especially, and now we've got to figure out what to do when we have more to come back, more than 10 in a classroom who want to come back, and we're Massachusetts, who is so, they rolled this out before they even put anything in place. So we're trying to see if we can license our gross motor rooms, since we can't use that as a shared space, but we have no guidance on how to do that. We've sent emails and with no response. So the black hole that is currently Massachusetts childcare, we're all struggling here. Can I ask if anybody who is open, what you're doing about masks? because we have been told, so masks, and for teachers especially, and how they're handling it for a day. And so masks, wondering about that. And the glasses, we've been told in Massachusetts that if you are caring for infants, you need to have, if you're giving a bottle, you need to have a special kind of protective glasses, so that you either have glasses that have like something on the sides and on the bottom, or you wear goggles, which is going to be really nice for these babies as they're bonding with their teachers. And this is in between long down supposed to wear and maintaining their 6 feet distance. Clearly no one who knows anything about infant childcare was involved in this, but just wondering any guidance on anyone, if anybody's else has had to do any of this, glasses or.
Well, the reason I keep turning off my video is I'm sewing masks while we're talking. Our university is going to provide 1 mask per staff member, and obviously that's not going to be enough. So I'm sewing masks while we talk. I did find some safety glasses for like working with tools at Meijer for the sides of your eyes. So that's what I've been using to solve that problem.
Meijer, you said, Jill?
Yes, or Home Depot, Target, any place
Like
in
that kind of.
I want to jump in. I know we're talking about staffing and enrollment, but about the sewing of the mask specifically, that actually was a task, because I don't sew, that I was able to delegate, and I felt like it was a justifiable work-related task to one of our support staff, so that they were continuing to do work-related tasks while not actually physically being able to, to be there, because we're not open. So if looking for ideas of how to find work for any of your employees, or how to get masks made, but she was excited, and we've got a ton of masks for our children as well as our teachers that have been delivered now by her to the center. So, okay, now back to staffing and enrollment. I'll stop.
Well, unfortunately for me at this point, I'm the only person who has not been furloughed. And the reason is faculty, it's not in the rule book that faculty can be furloughed, so they kept me on. So I'm doing everything by myself for a center that normally has 150 children. So it's been hectic. I'm really hoping that this conversation can help me with is my staff are currently earning more on unemployment than they do when they work because of the additional CARES Act $600 per week. And so when it's time to reopen, I'm trying to figure out what is the right and fair way to decide which staff members have to come back to work, because they will earn less money when they return to work. How are you deciding which staff to bring in when you're not bringing back all of your staff at once?
That topic was definitely brought up in the last Zoom, specific to furloughs, that people are finding their staff are happy with the furlough pay and unemployment. So when we reopened, none of our staff were furloughed at the time, but just speaking from our experience, we surveyed our staff to see which could come back, because many of our staff were still with their kids at home and just couldn't, or maybe they didn't feel comfortable yet. So we had enough staff that were able and willing to return for our first and second phase. But we did let our staff know that at some point, everyone will be needed and will have to return to work. So.
I'm curious if there are any other lab schools out there, and what you guys have done with student teachers. We're looking to open in the fall, and we're supposed to have teachers with us, but we're just trying to figure out what that can look like for them, just because when you think about all the other places that students go on campus, that circle of contact gets really big. So I'm curious if anybody has tackled that issue or not.
Hi, Molly. I'm Amy Bryan from UT Austin, and we're not back on campus yet, but I'm in a similar situation where I've been told that for the classes that place students with us, we need to figure out some sort of hybrid model where it can be some days and then remote other days. So we've been playing around with that, and kind of for our students, what we're thinking is we would have at least one student in each group of children each day. And the way that we would do it is like one Monday they would be there, the next Monday they would be doing remote assignments and meeting with us virtually. Mm-hmm. So I think that's the only way. I mean, we have vast numbers of students who come through our lab program, and not serving them is not an option. So I'm trying to also figure this out from a licensing, but I have to apply for some sort of waiver or variance, because right now Texas licensing says you're not supposed to have any visitors in the building at all. So they're technically not staff. So I'm so curious if other people have figured out, like, you've paved the way. I would really appreciate any tips that people can offer.
Yeah, we've already told our department that we won't be having any practicum students, so those lower level courses. We are deferring to the spring, and just hoping that we have some better options come then. I don't know if we also just done a survey of the students that are coming, the student teachers that are supposed to be coming in the fall, to see like, are you working at another child care center? Like, what does your circle of people look like? And just trying to work with our partners to make sure that we keep that circle as tight as we can. But it's a little daunting to try to figure out. So if anyone has any advice, please, it's welcome.
One of the we're doing those practicum type students is we have cameras in all of our classrooms, and we have signed permission from the families, so they'll be observing the children in their courses by video. And so they won't actually be in the classroom. It's not ideal, but they're able to still get their practicum experiences completed by using the videos. With the student teachers, fortunately, the student teachers that we have right now also happen to be employees, and so they are allowed in the building.
Thank you.
For people who are open, can I just ask how your teachers are doing? I worry about the kind of the emotional drain and the physical drain that this will have on a staff. So I'm just wondering, for those of you who are open, what you're doing to support your teachers, and any guidance for us as we start that, and anything we can do to prepare them for what this will be helpful.
Well, for us, I think everybody was really nervous to go back, and had a lot of preconceived notions about what it would be like, and how scary it would be for the kids. But we're on our third week of being open, and by and part, the staff are so happy. A, because they're back with kids, and B, because our group sizes are so much smaller that so many of them are like, whoa, this is so nice. But, we have maybe one or two staff that are nervous or, a little burnt out, but they were prior to this as well. So it's not a new thing for them. But yeah, I mean, so far things have been going really well, and I really attribute that to how few classrooms we have open and the class sizes that we have right now.
Hi, we're open here in New York and Stony Brook. We've been open pretty much from the beginning. We closed for just a couple of days, open only for essential healthcare employees because we're affiliated with a hospital. And the staff person was just telling today, not all our staff are back. We have about 9 more staff who are still home, choosing to work from home or having a medical reason for working from home. The was rough. It was, people were scared, people were anxious, we didn't know what to expect. This was back in March 17th. So it was just, people didn't know what to expect. But after the first week and certainly 2 weeks, people got much more comfortable. They felt, describe it, coming to work with the smaller group sizes and smaller staffing as coming into a bubble where they felt safe. We're doing a lot of extra cleaning, social distancing among the adults. We're not expecting kids to social distance. We're giving them lots of space to spread out. But it will be really tense for staff coming back, no matter how well prepared they are, because it's unknown. And a lot of people haven't really homes or little bubble. So it feels scary to come out someplace where you're around people and moving around freely. And so that it took time, but again, there's always a little bit of anxiety, I think, for everybody, because we just don't know. And but people adapted pretty quickly. But now we're worried about them burning out because it's been nonstop for the people who are here. We're trying to accommodate it with some days off or working half day here, half day from home, just try and give people time to catch up. But it's also hard because some of their coworkers are not here. And now they're feeling that, okay, we need everybody here. We need to share this. Even with the small numbers, it feels like a lot more work because of the kids off outside. Luckily, it's good weather. But yeah, it's coming back no matter what. Be prepared for people to be anxious and scared. And it's going to be, because it's going to be different.
One of the things that our state is requiring is that we close common areas, not the classrooms, but like the staff lounge. So I'm wondering how to take good care of my staff and have them not feel so alone when they're not allowed to be in the same room with each other.
Yeah, I worry about that too. My staff are very close, and they normally on their lunch breaks get together and pick each other's brains and just vent and whatever. And I'm really struggling with how they'll still be able to do that. I mean, they could always go outside to the playground if the weather's nice, but if not, there's really limited options. Even the staff room we have wouldn't work because it's so small. So.
What's interesting is we didn't officially close our staff lounge, but it's a very small space. I was in it. Go to the water, have water.
Yeah,
it's really funny. They have opted. They might sit outside. They might sit in their cars. Some people are working shorter days, so not to take a break. But it's staff lounge. Nobody's going in there.
Opted not to close the staff lounge because they're all using the same restrooms. So I couldn't stop that, and we had to put a cleaning plan in place for them to go to the restroom. So let them have their room as long as they clean up behind themselves. And we put different, excuse me, we put different signs in there about the computer, wipe me down, spraying the area. But unless we were going to provide a bathroom for every staff person, benefit having that rest space, because there's nowhere else in the building for them to go.
Well, that's my issue, is there aren't a lot of places for them to go, but the state is telling us that we cannot have a common break room. I'm thinking, well, then where do they go for their breaks? So hearing about going to your car, I guess, is something. We have a rooftop garden that nobody ever uses, and I'm thinking about setting up umbrellas to create stations out on the rooftop garden. But Yeah, no staff lounge, and that's where the soda machine is. So
Rooftop garden sounds lovely.
it's hot.
Can I ask to those again, to those of you who are open, just to help, and thank you for taking the time to help the rest of us. When you are, one of the things we're hearing in Massachusetts is they don't want floating teachers, they don't want subs, they don't want assistants, they don't want direct and out the things we do to support teachers, to give them breaks, to give them support if a child needs somebody extra. And then vacation coverage, so that because our teachers have a really nice vacation coverage. So we're trying to figure out how that is going to look, and how to, again, which is why I worry about the length of day and how to manage that. And we're fighting so hard to have more than 2 adults with this little cohort of 10. I don't mind the cohort of 10, but I want more adults, maybe morning and afternoon adults or something. So just for those of you who are open, how are you supervising classrooms? You know, different states you can go in, but how do you supervise? How do you support? How do you give them breaks?
Here in New York, we are still waiting for real guidance from OCFS, our licensing agency. So they're giving us, there are no regulations, there are no mandates, but we're going by their guidance and the CDC guidance, which says, as much as possible, you don't mix groups, you don't move adults around. We're not mixing groups, but we are having some adults who do go into different rooms, and we have sometimes too many adults for the number of children, but we need them in and out. Covering breaks, and we are bringing in some of our part-time support staff to work with us to cover that. Sometimes you only really need them for an hour or two, but you can't bring somebody into this environment and say, but we're only going to pay you for 2 hours. So they're here longer. So we're really struggling with that. We feel times there are too many people in the classroom, but there's nowhere else for them to go, and we can't send them home and ask them to come back in another hour, for another hour. So that I don't know how other people are making that work, but we're certainly well over ratio, but we're struggling with that.
We're, of course, but our plan is to have 3 teachers with each group, like stable 3 teachers, and we would only be open from like 9 to 5. Everybody would work the same schedule. In DC, there's a regulation that you can't have fewer than 2 teachers regardless of how big your group is. So even if it's a group of 1, you have to have 2 adults. So that's why we decided to work with the 3rd, so that could be like a cushion for vacations and for covering each other's breaks, and because of all the back and we would to kind of get kids from the front door to the classroom and that kind of thing. So, and that goes back to my desire to bring up the number of children up just a little bit, because, we have almost half the number of adults as we have children. And it will probably seem like overkill in terms of the number of adults.
And I should say that we at Stony Brook, we are open pretty much for our regular hours, 6:30 a.m. We were 6:30 a.m. to 6 p.m. We still we've moved it up to 5:30, but other than that, our board does not want us to limit at the moment, which is one of the other reasons we have so many adults, because a teacher who comes in at 6:30 or even 7:30 can't be here till 5:30, 5 days a week. So that's part of our dilemma.
Yeah.
So that is allowed in your state, though. See, that's what we're trying to figure out in Massachusetts, because they're saying just those 2 teachers at all times, and that we just feel is not workable.
You're not allowed to have a 3rd?
Yeah.
No, you're supposed to have 2 teachers with your 10 kids.
Oh.
And that what we're talking about, we're trying to do is extend the number of teachers who can be with that group of 10, whether you can have 3 and then another college assistant. So we're with our preschool rooms of 16 or so. So yeah.
Wait, okay. Wow.
Darlene, hearing you share makes me grateful that my state isn't giving us directives like yours is. I know that not having guidance can feel uncomfortable, but definitely not having the wrong type of guidance is helpful. I'm curious to know, for those who have reopened, I know I'm still in the world of Zoom and we have our weekly staff meetings. I mean, we're here together now through this format, but once you reopen, because some will return and others who will continue teleworking for various reasons. What have you done for your staff? Do y'all still have your Zoom meetings together, or did those stop once you reopened? Just how have you addressed that?
We actually have Zoom meetings for the people who are at home. People here can jump in, but that's also another source of tension because they often can't get out of the classroom, or not enough of them. So we're going to try running a first all-staff Zoom meeting next week after 5:40. How many of the people who are coming to work during the day will come to that, and we're not necessarily expecting them to. We hope they will. And then we're having on-site meetings, for our lead teachers. Again, we can't congregate everybody, so it's my colleague over here, Josephine, is running the Zoom meetings once to twice a week. When she can, it's twice a week to keep the people at home in touch and encourage them to come back and work if they can. But so we really have a division now: the staff who are here and meet in person, and the staff who are home and meet on screen.
Yeah, we have been doing the same, and we were pretty strategic with the staffing of our new classes, and staffed them with teachers from that age group. And since the group is mixed and it's not, what the old classes were anyway, we pulled a teacher from each team, basically, each old team. So there's one teacher who's in the building, one teacher who's still remote working and connecting with the remainder of the families who are not enrolled currently in the center. So there's still, since we're still in such early phases and there's not as many families in our centers, there's a lot of connections still happening, and a lot that remote staff are doing and then in-center staff are doing. I'll be interested to see what it looks like as we get into phase 2 and there's more people back in the centers, but right now it's been working like that. And to speak to the staffing side of it with regards to hours, we did shorten our hours to be 7:30 to 4:30, and everybody works really close. We didn't stagger it a whole lot, but they are staggered a little bit. And then what we did for breaks and planning time is have a floater designated to 2 age groups. So they're not floating to every classroom, but just a couple, that they go in and help with that kind of coverage. They're also, they work, a half day. They work 4 hours, a morning floater and an afternoon floater. And they help with the extra cleaning and sanitization. They help with the drop off and pickup procedure. So yes, we are definitely overstaffed and budget-wise that hurts, but right now it just kind of is what it is, and it's working though, so.
That's interesting, Kelly, because I had not even considered bringing children back into a different group configuration. We were kind of already thinking of based on which children were coming back into what classroom, coupled with which teachers are. Just because you were a young toddler teacher when you left, you might not be back with young toddlers when you returned. So, and that was kind of a question I thought I had before, as far as anybody else's experience with that. But had not thought of even the whole reconfiguration of the children as well. But that was done just based on the numbers that were returning and the need and how you needed to split them out. So it's starting to look at everybody as a collective group and whole instead of different classrooms.
Yes, yeah, we really just looked at it age group wise and not classroom, because some of our age groups we had three different infant classes, 3 different 1s, 2s, and so on. And yeah, it would have been really challenging, because also the guidance at the time was, if you set up a classroom and let's say you only enroll 5, the guidance was don't add more to that later and get a different germ pool added into an established one. So the classrooms that we set up in phase 1 are going to be the classrooms for the remainder of the summer, and same with what we're doing for phase 2 and so on. We typically transition all of our kids in August when the school year starts, and our pre-Kers go off to kindergarten. And we're still planning to do that. But for right now, these new classrooms are what they are for the rest of summer.
Okay.
I'm glad you mentioned budget earlier. I'm listening to the great ratios that you have for the kids, and I'm hearing messages, cut every cost you possibly can. And nobody's come out and said it bad. I want to make certain that our program is still here next year. And so I am trying to do the right thing for the children and at the same time protect the program from disappearing. And so, you know, our ratio, which we normally have up to 20 children in a preschool classroom with a 1-to-10 ratio, NACCE. And so if we have a group of 10 preschoolers, right now we're looking at scheduling only 2 teachers over the course of the day. One would work 7 to 3, the other one would work 10 to 6. They cover each other's breaks in that overlap between 10 and 3. And we one available floater per age grouping so that they would be exposed to a lower. So our team members will be alone with their group of children from 7 to 10 or from 3 to 6. But still, it's a much smaller group, less chaos. And I was starting to feel okay with that until I started hearing your ratios. Anybody have thoughts on that?
We're not allowed to have only one adult with a group, which is the reason why we shortened our day, because normally we would both have 1 teacher per group, groups 9. So that's all out the window. We have to have a minimum of 2 from open to close.
And I always have had 2, just, you know, to protect the staff as well.
Yeah.
But at this point in time, with the budget being what it is, I don't know that we have a lot of choice, but we do have cameras in every classroom, and I have an iPad that I can move from classroom to classroom, so I can see what's happening in the classroom throughout the day. But still, I'm not comfortable with having a teacher by herself, but I don't know that we're going to have any choice at this point.
Like Jane in DC in Massachusetts, you cannot have a teacher by themselves with children, so it's not an option for us.
Jill, we're like you. We are able to have 1 teacher with a group, a small group. And right now, budget-wise, we don't have much of a choice going into fall semester. Working on that budget for the next fiscal year, that's what we're planning on with our older age groups, 3s and up, having less children and 1 teacher, and still on reduced hours. Yeah.
Well, we normally have 4 full-time staff members per classroom, 2 7 to 3 and 2 10 to 6. So you always have 2. And it also makes meetings in the middle of the day possible.
Right.
But now with all of this change and you have half the number of children,
Yeah.
so I'm fighting a personal battle with myself. I don't want my teachers to be by themselves, but we may not be if I put 2 in the room.
Right. Yeah. That's kind of where we are as well. It is not a great choice to have to make, for sure.
The cameras help me feel a little bit better about it, just because I can back them up if I need to, you know?
Yeah.
Are your cameras just for you?
Yes,
Cool.
they are not
Okay.
open to the families to see them, but it is recorded. So if we
Yeah.
need to investigate something, we
Right.
can.
Same with ours. I do wonder how the parents are gonna be emotionally with not being able to come into the building, come into the
I've wondered
classrooms.
that. Yeah. Yeah, they won't even come past the front doors to the building. So I've wondered if this footage, but
Yeah. I mean, let alone what the children are gonna be going through,
yeah.
not being able to have that drop off time.
Yeah, it's definitely different. We started the front door drop off prior to closing in March for that last week or so. And then we continued when we reopened, and surprisingly, the kids have done well with it, and same with the families. I think the families, I saw somebody mention in the chat, they're just happy to be reopened and are willing to, you know, go along with all of these different protocols and procedures we have in place. But it is so much different. I mean, there's very minimal interaction between teacher and parent or caregiver. We do use Learning Genie, so the teachers communicate and post, you know, throughout the day with that. But we're very much a face-to-face and lots of conversations with our families, and that just really isn't happening anymore, which is unfortunate.
So you just gave me an idea, since can't front door, and we will have that floater available between 2 classrooms. Maybe we could schedule daily available Zoom meetings with the teacher, where the teacher would go to an unused classroom and use that computer to have a parent Zoom meeting, so that at least they're able to communicate.
Yeah, that's a nice idea.
So thank you all.
Yeah, one of the reasons that I'm so glad that I don't know if you saw in the chat that Georgetown had a voluntary furlough program, and 3 of my staff chose to take it, even though they'd be making more money on unemployment. But the ones that didn't felt very strongly about maintaining those connections with the kids and the families, knowing that when we do go back, they didn't want to be strangers to them, knowing that they're going to be dropping them off at the door and they haven't seen them in months. So
Does anybody who's open had any like new families join? I know a couple people in the chat box said that they about the kids not being able to come in with a parent. And we're opening in August and hopefully welcoming some new families, but I'm a little worried about that transition. So any like, somebody mentioned an idea about doing like a virtual walkthrough and sending that to families with pictures and things like that to help with that transition. But any other ideas for that would be great.
Hey, I'm thinking about setting up individual times for parents to come in with the child and just me or just the teacher, just to kind of spend time in the room before the child come in with the parent, and it's, you know, really warm and welcoming, and this is just going to be so different. So, but I also think part of that is my expectation, because for the kids, this is their first time going anywhere, so they don't really have an expectation in mind other than, you know, for us, we've established it as our general protocol, but it's all going to be new to them anyway. So I think if we just kind of introduce it as a positive experience, they'll probably, you know, they're very resilient, they'll be all right. It's the teachers and the parents, I think, who are going to need that extra time to form their relationship. So I'm thinking about doing, like setting up our sign-in station on one of our side yards so that they can outside San Diego stuff all year long. But that way they can play together a little bit, the parent and the child, before the parent leaves. And then, we usually have a goodbye window where the child is inside watching them drive away. So we're just kind of trying to adapt. We're going to have all this space and not that many kids. So we're going to try to use it creatively. We're not open yet though, so I don't know.
Thank you.
We are working on books right now. We do transition books, and we're big on the transition. And so we move up every year. When the kindergartners go off, everybody moves up. But before that, we spend the whole month of August and a good chunk of the children, getting to know their new teachers. Their teachers come in and eat lunch with them. We do home visits. We do transition visits for the new to the center families individually. Then they come in as a whole group. And we do so much with that I worry about anyone coming in too. But one of the things we're working on right now are books. So we do little books. So each classroom does a book about their room. Here, I know I'm the teacher. This is what we do. Kind of, welcome to the blue room or the purple or whatever room it is. And so we're like, right now I have the teachers, one of the things they're working on is creating books for this is what it looks like. Here's Darlene. I don't even know if I have my map from doing, but we do our morning Zoom with the whole school where the teachers are all saying, here I am. I'm putting on my mask. Oh, do you know who it is? Yeah, it's still me, kind of thing. So we're thinking about doing these books that are going to talk them through and show them what it's going to be like so that they'll be able to take them and read them. So we create them, we, publish them, and then usually we, laminate them and 3-hole punch them and send them off with families when they come in to visit. Now we're probably going to be emailing them and they can upload them to their own computer and print them out. But I think that's going to be super, super helpful for them because they'll just read it. Obviously not with the infants and the and preschoolers. They're just going to read that over and over and over. And I think that'll really help.
Is anybody thinking, or do they currently have any webcams they're using for parents? We haven't had that in the past because we've had observation rooms, but with the observation rooms being closed, we're just wondering if we should maybe look at setting something up.
We actually considered that when we installed the cameras in all of our classrooms, but there was a lot of concern from the staff. It's very easy to see, but not hearing everything that happens around it, knowing the context, misconstruing what's happening in the classroom. And then the concern too is what if you have a child in the classroom who is a bit more challenging and just has some things to work through, because sometimes the other families get frustrated and want that child tossed out. And so we felt like it was more respectful of all of the kids in the room to not do that.
Okay. And that's what we've always thought in the past as well, is why we never have done it. But then I had some parents asking, and my administration are wondering if we should go that way.
I'm starting to think we might be able to do something like a planned discussion with the whole class, that, like a team meeting or a Zoom meeting between the classroom and the parents during the day, rather than just open access to the ongoing camera.
Thank you.
Has anyone had to figure out how to prioritize who gets to come back if you don't have enough spaces for everybody that wants to come back? Have you, besides essential employees, but have you any priority system for other families?
We are struggling with that right now. As I said, we've been open for kind of easy call, the emergency essential employees providing healthcare critical operations. But now we're licensed for 160. We have about 35 here now. So that's a lot of families who are now, the board member designed a survey asking them their need for childcare, when, now, spring, fall, or summer, and what they do on campus or at the hospital. But even with that information, a great response, responded, almost everybody's planning to come back. and we won't have space for them all. And we are right now pulling our hair out. As I'm sitting here with you, I'm trying to send an email to our board again. Even with the survey data, it is so unclear who has priority over who. And we don't want to be making the decision. We want a campus to make it, but it looks like it's falling in our lap. And this is awful. We're just getting bombarded with parents who feel they need to be back to work, or maybe do need to be back to work, and looking to us to make that decision. So yeah, if anybody comes up with another plan, we'd love to hear it.
And not a plan will be, but I too just sent out a questionnaire to all of our families to find out what they are thinking on returning. And I just tried to ask as many questions as I could about what's their affiliation, you know, are they faculty, staff, students? Are they, we also have a partnership with another organization, so that I can hopefully use that information. But that's the biggest question I have too, is how do you decide which staff come back, which children get to come back? So I just posted our questionnaire. I can't say that it's wonderful, but at least it's a starting point. I appreciate all of the documents that everybody through this, they get me started. So anyway, there's our questionnaire if anybody wants to use it to build your own.
I know in one of the earlier breakout meetings, one of the state's educational institutions was set up so that if staff members, meaning university staff members, were still expected to work remotely, they had lower priority for getting their children back in. It was the staff members who were expected to come back onto campus that were supposed to receive first priority. That isn't Indiana, or where that was states, somewhere in California. That was on one of the earlier breakout rooms.
That's the case for me as well, that we're giving, the plan is to give first priority to the people who have to work on campus in person. But the interesting thing is that the campus is still trying to figure out who that's going to be. So I'm actually meeting with HR this afternoon to compare my survey with their survey, because I have the employees self-reporting, yes, I expect to be going back to work, but she's HR and she's like, well, this person thinks they're still working remotely, but they're not. So, you know, there's so much still evolving from the university, because the campus is still pretty much closed as well. It's about who's going to be doing what. They're trying to encourage this low density campus model so that if you can work remotely, you should. But childcare is one of the factors that would make it possible for you to work in person.
Yeah.
So it's just like,
that's why I'm wondering also if we
juggling
should consider the
those.
children's needs, you know, if the youngest children should come back over the older children that are a little bit more independent, or if the children that you know, are receiving services and need that consistency over
Yeah,
them.
I
don't,
thought that
mean,
too,
that's
and
just
even-
very subjective though.
even the issue of younger, newer children, more literally hands-on content, should that be a factor? But you know, if the university is saying, well, this is my facilities project manager and I need them, then, you know, no matter what their child brings to me,
right,
I need to figure it out.
Yeah.
When Massachusetts announced, when it leaked out that there would be no infant care, no care for children, an infant in Massachusetts is under 15 months, and it was broken evidently by a licensor who was as they were trying to put this together with the Fox 25 local news affiliate, it broke and it went viral, and the pushback and the, you know, what are you working, you know, condemnation, and what are you saying with all of this? And when they did come out, first of all, they took the licensors out of the room, so the licensors were not involved evidently in the final putting together of this guidance, which is probably why it's a little messed up because of this leak. But what they came out with is there is now infant care in Massachusetts when there wasn't, because of this pushback that happened. So, you know, I don't know how that would go for the rest of you if that comes out in other states, but it did not go well when it was floated out there in the news media.
I don't know if this is just me and maybe an unpopular position. I'm having a really hard time with this idea of pushing back to allow regulations that might not be safe for our health. You know, I feel like it's such a complex and confusing issue. And sorry, there's an airplane flying over my house. But, and I understand, you know, the individual rights and women's rights and human rights and everything who, you know, everybody needs to go to work. But if we're saying that it's not safe, then how can I push for that? You know, like I'm promoting this budget model that is a complete fantasy. Like it's not sustainable. I don't know what's going to happen, but I also just go with the saying, I want you to allow me to take more kids. I want you to allow me to have floaters. I want you to allow me to do all these things, when if it comes down to those things I'm pushing for are going to, you know, result in somebody getting sick or a second wave happening in our area, you know, I'm just going to feel responsible somehow. Does that make sense?
I think that's one of the I think probably the reason why many of us aren't sleeping at night, because you want to take care of you want to make sure your school stays viable. You want to support the families who are working. You want to make sure your teachers have jobs and that everyone has jobs. But our first responsibility is, you know, health and of the children as well as their physical health. And they don't seem to know that much yet. But I do think Denise from Stony Brook was like my hero. I quoted Denise to staff members after talking, which Denise said that she had not had transmission of COVID in her program when her teachers are taking care of children whose parents are on the front lines working in hospitals. And I think that kind of evidence is very helpful for us. And I think is very helpful as we learn more about this and they're making the decisions on who gets to come back. So Denise, you were my hero, just saying.
Thank you. I don't feel much like a hero today. I feel like the bad guy telling parents, I don't know if I can make you back in here when you want, but we did meet with two of our board members who are healthcare professionals, one in pediatrics, and this is just recently. We'd already been doing this for weeks, and they were saying we were doing all the right things, and we were being rational, not over the top. And it was encouraging to hear that the safety precautions we were taking, which were manageable, time consuming, like, you know, bleaching, disinfecting, but we weren't putting kids in bubbles, we weren't keeping everybody 6 feet away all the time, and we still managed to keep everybody healthy. So again, it's the work our staff is doing, but it's also, I'm sure there's luck involved. There has to be involved.
Yeah, I mean, I just, in terms of the number 10, why is that a magic number? You know, could we go up to 12? I mean, if we need to have another teacher in there so that we can allow our teachers to get breaks and still maintain our 2-person minimum in the classroom like licensing requires, can we get 2 more kids in there? And what's the difference between 10 and 12 from a health standpoint? Is it the contact tracing, or is it just an arbitrary number? So that's, I don't know why that number 10 is so magical, especially when the general public numbers are going up in phase 2 and 3. You know.
I agree, and I think what's hard about this is all these decisions are being made without a lot of data to drive them, and data. So they're making decisions on group sizes. They're making decisions on, you need 6 feet, you have to wear this, you have to do this, but we haven't done it yet, and none of us really want to be the guinea pigs. As Jacqueline says, we don't want to be the ones, you know. So we're on the new child care center is the new, you know, for us in Massachusetts, Biogen of, you know, whatever, but. Yeah, it's really hard.
Well, I'm just going to let everybody know it's a little bit after 3, and if anybody has anything else to add or any other question you really wanted to get off your chest, go ahead and voice it now. And like I said earlier, this recording will be posted to the N4C website under our COVID resources. So if there's something you missed or something that someone posted in the chat, that can be found there as well.
Just really quickly, I would really appreciate it if anybody has the clause. I've heard it in a lot of these N4C conversations that you have to have some sort of legal clause that basically says no matter how hard we try, we can't promise you that children will not get sick. And so if any of you have something that you have worked through and are willing to share that, I would appreciate that very much.
We did work with our legal team at UF to develop a disclosure statement. So I will post that to the listserv for everyone. Well, thank you everybody for tuning in and for participating in this discussion. If there's a topic that you're really wanting some more information on, or if you feel like we could continue this topic's discussion, just let us know. Reach out through the listserv, or you can email me directly. And we will set up another Zoom session for everybody. And hope you enjoyed this discussion. And if you tuned into the ones earlier as well, thank you for participating in those. Have a good afternoon.